Hello. Today we are going to learn about urinary and reproductive system. I will focus on the male reproductive systems with urinary systems, but the female reproductive system will be in the separate lecture later. The purpose of the urinary system is to regulate the composition of the extracellular fluids of the body by moving their harmful substances in the form of urine, such as nitrogen waste, while retaining beneficial products for the reuse. The anatomy of the male urinary system is on the left, and the female urinary system is on the right, showing the kidneys, ureters, bladder, and urethra. Urine is made in the renal tubules and collects in the renal pelvis of each kidney. The urine flows from two kidneys through the two ureters to the bladder. The urine is stored in the bladder until it leaves the body through the urethra. The prostate gland is also shown in this photo. The microscopic examination of kidney tissues reveals the presence of approximately 1 million nephrons. These tiny units responsible for filtration, absorption, and excretion. The structure composes of blood vessel, glomerula, and tubules as shown on the rightmost picture on this slide. These are examples of words related to urinary systems. Nephr and renal mean kidney. If you see suffix itis after nephr, and it is a nephritis, mean the inflammation of a kidney. Nephrotic syndrome, TIC or TIC, means condition. This word specifically defines the disorder that the kidney excretes too much protein in the urine, and the patient comes with the weight gain and body swelling. The cyst means bladder. The infection of the bladder or urinary tract infection at the level of bladder is called cystitis. Urea means urine. You may need to get familiar with prefix as poly. Polyuria means over-urination. Oliguria means reducing of the urine volume. And means no. So anuria means no urine excrete out of the body at all. The words ureter and urethra should not be confused. Two ureters comes out of the kidneys, while urethra is the only one in the middle of the gland penis, function as both passing urine and the semen. Please also review suffix like trypse, ectasis, stenosis in your reading material. Then find the meaning of these words on the slides. There are some more examples of common words of urinary system and procedure related as such. Nephrologist, the doctor for kidney diseases. Cystoscope, looking into urinary bladder via a instrument. Intravenous pyelogram or IVP is an X-ray study to study the drainage pattern of the kidneys. And you must know the name of renal failure, both chronic and acute renal failure. And the word like end-stage renal failure or end-stage renal disease, or we call it as ESRD. This slide demonstrates the basic male reproductive systems. The purpose of the male reproductive system is to produce, keep, and transport the sperm and semen. It also produces male hormone, which is essential for sperm production. There are 2 testes and 2 scrotum. In the testes, the tiny tube named seminiferous tubule produces sperm to be collected in epididymis. Then, the sperm will be released out through the vas deferens and ejaculatory duct, finally through the urethra in the penis, and the same canal with the urine. Please spend 5 minutes review the video on this video link given below. This slide shows the male reproductive system related medical words, like andro means male, baland means penis, cervicobalainitis means inflammation of the penis, or prostate gland inflammation is prostatitis, or prostatomegaly means the enlargement of the prostate gland. The spermat is a sperm. Spermatocele means the swelling or the cyst-like mass that contains the sperm. After the completion of this lecture and video link, the student should be able to describe the structure of the urinary and the reproductive system of the male. The student should be able to analyze the word related to these subjects. If you have any question or suggestion, please don't hesitate to contact me. Thank you and see you.